everyone, and welcome to the next installment in our series, Dr. Gilbert Hosts. My name is Dr. Rebecca Gilbert, and I am the Chief Scientific Officer at American Parkinson's Disease Association. Thank you so much for joining us today. If you're watching this broadcast on YouTube or Facebook, please say hi in the live chat and let us know where you're joining us from today. I am very excited about today's guest who's with us, Dr. Daniel Corcos, who is Professor of Physical Therapy and Human Movement Sciences at Northwestern University in Chicago. Dr. Corcos will give us a brief overview of the topic of exercise and brain health in Parkinson's disease, which is a topic that is on many people's minds. And after that presentation, Dr. Corcos will be taking your questions, so get ready for that. American Parkinson's Disease Association, or APDA for short, is the largest grassroots network dedicated to fighting Parkinson's disease, and we work tirelessly to assist the approximately 1 million people with Parkinson's disease in the United States live life to the fullest. Please visit our website at apdaparkinson.org to explore all that we have to offer, and you can also contact us through our toll-free helpline, 1-800-223-2732, as well as via our social media outlets. And now I would like to formally introduce my guest. Daniel Corcos obtained his PhD in motor control from the University of Oregon and was on faculty at the University of Illinois in Chicago from 1987 to 2014. After that, he joined the faculty at Northwestern University, the Feinberg School of Medicine, where he is now Professor of Physical Therapy and Human Movement Sciences. Integrating neuroscience and expertise in clinical trials, the research of Dr. Corcos focuses on exercise interventions that aim to reduce symptoms of disease and delay the rate at which disease progresses. His current research suggests that high-intensity endurance exercise slows down the rate at which Parkinson's disease progresses. He is currently the primary investigator of a phase 3 NIH-sponsored clinical trial on endurance exercise and PD called the SPARKS-3 trial, and we'll hear more about that from Dr. Corcos. I am so excited to be talking with Dr. Corcos today. Dr. Corcos, welcome to our broadcast, and thank you so much for joining.
Thank you, Dr. Gilbert, for that very kind introduction. It's a real honor and it's a real privilege to be here. Next, I will be talking about epidemiological studies. Next, I'll be talking about epidemiological studies of exercise and Parkinson's disease. There are three main points that one can take from the epidemiological work that has been done. The first is that those in midlife who routinely engage in moderate to vigorous exercise have a lower risk of developing Parkinson's disease than those who don't. Secondly, the fitter one is, the better one's cardiovascular system. This is also associated with better cognitive and motor scores in those who have PD. And also, longevity, increased lifespan, is also associated with increased physical activity. Next, I'm going to talk about fitness in Parkinson's disease, the importance of fitness. So there's a very famous neurologist by the name of Jose Obeso, who, whenever he sees a person with a disease, the first thing he tells them is it's really important that we get you as fit as we can. And then when we've got your overall fitness under control, we can then worry ourselves about the Parkinson's disease. For those of you who've been following COVID-19, it's very, very illustrative. If one is in great health and one gets COVID-19, one's prognosis is pretty good. There are exceptions, but it's pretty good. If one goes in poor health, one's progress is less. And so anything one can do to compensate for vestibular loss, neuropathy, spinal stenosis, lower back pain, arthritis, osteoporosis. There's currently a very big NIA-funded study to look at osteoporosis is very important, and also prior strokes. So even moderate and less vigorous activity can improve fall risk, and that is very important. I now want to transition and talk about the symptoms of Parkinson's disease and how exercise can help. Now, what has become very clear to neurologists recently, and that's why it's at the top of this slide, is that exercise can improve cognition. I published a paper in Movement Disorders in 2015, clearly showing benefits of exercise on attention and memory. And this was voted the paper of the year in Movement Disorders precisely because cognitive decline is so important. Anything to improve depression is very helpful. Sleeping well is fundamental to good health, and exercise can improve sleep impairment. It can decrease constipation. Now, in the short term, exercise does cause fatigue. So don't get confused here. There are short-term effects and there are long-term effects. So in the short term, yes, you work out, you get fatigued. In the long term, exercise will decrease your fatigue. Stopping or slowing osteoporosis is absolutely essential. Hip fractures are a disaster. Anything that can be done to stop that is great. Improving motor performance, being able to go outside, do activities is great. And the way you improve motor performance is by improving strength, balance, posture, and gait. There's also evidence that it may improve drug efficacy. Now I'm going to talk to you about what many people are working on at the moment and what everybody hopes is just around the corner, and that is the idea of neuroprotection. The idea here is that can we do anything to protect the nervous system and thus slow down the rate at which the disease progresses? The evidence for exercise is really quite promising. It's not certain by any means, but it's really quite promising. And at the moment, it is the best treatment we have because drugs have not really worked at this point in the area of neuroprotection. And exercise may enhance dopamine signaling, which is important. It may increase nerve growth factor. There's a lot of evidence that it upregulates brain-derived neurotrophic factor. There are studies which have shown that exercise leads to an increased blood flow in the brain. And this is really, really important because then this is taking oxygen and nutrients to nerves in the brain. And that's what's important. It promotes beneficial changes to the brain immune system. There's a protein which many people get tested for every time they have a routine blood draw, C-reactive protein. The evidence is quite clear. It's higher in people with Parkinson's disease. It can reach quite high numbers, and exercise will reduce it. Exercise can decrease oxidative stress. It can increase nerve connections. And there's hints of evidence that it may produce new nerve cells. So now I want to talk about the question which most people ask all the time. And we're now going to get very, very practical. So I hope it's clear to everybody listening that the evidence is stunning and overwhelming and irrefutable that exercise is good. Now, I sometimes get asked, do I need to do all 4 types of exercise? And the answer is yes, okay? It's a little bit like asking, can I get by on a protein diet? Can I get by on a fat diet? Can I get by on a carbohydrate diet? Can I get by on a diet which is absent in vitamins? Well, the answer to that question is no. One is after a balance, and that's because the system needs a balance. So you need to be doing endurance exercise, and that is simply because endurance exercise targets the heart. And the heart pumps blood, and the blood goes to the brain, and this is very good both for heart health, and it's good for brain health, and it should be done. Then there is strength training. Now, one of the questions which often comes up is, should I only be doing this early in the disease? Should I be doing it late in the disease? Strength training should be done at every stage of the disease. So some of you listening will be quite advanced. Some of you may be wheelchair bound, but there are all kinds of exercises that a good therapist can give you to do whilst you're sitting down. And the reason this is very important is that if you look at many people as they get progressively more advanced, and this is also true of people who are frail, getting out of a chair, transitioning becomes very hard. And a lot of people then require considerable use of the arms. And so the stronger your arms are, the easier it is to transition. And so exercise is great at all stages of the disease. It gets targeted slightly differently depending where you are. One of the hallmarks of advanced Parkinson's disease is a balance disorder. There's a stage called the Hoehn-Yahr 3 stage. At this point, people have lost some of their underlying postural reflexes. They become unstable, and there's compelling evidence that exercise such as Tai Chi is very, very beneficial. Many people with Parkinson's disease are rigid and they feel stiff. The more colloquial term is stiffness. The technical term is rigidity. There's no question that stretching is really good. So a well worked out program, a well worked out regimen has all 4 components. So I'm now going to move on to CDC guidelines, which are the recommendations for older adults. And it is very similar in Parkinson's disease. There's nothing magical about Parkinson's disease, or any disease, in fact. The basic principles apply across all the diseases. And it's clear that there are substantial health benefits related to 2 hours and 30 minutes of moderate intensity activity, or an hour and 15 minutes of vigorous intensity. One can do a mix of the two. The evidence on interval training has not been really published yet, but I think when it comes out, for those of you who like to do high intensity interval training, there's certainly a benefit to it. And then you'll see below muscle strengthening activities, which are really, really important. So not only should we be doing aerobic activities and muscle strengthening activities, we should also be doing skilled exercises. And they serve a slightly different purpose. So in endurance exercise, we get the heart rate up and continue to work at a high heart rate. In weight training, we overload the muscle. Skilled exercises are really designed to challenge the brain in different ways to keep the brain well wired, or to even rewire the brain. Now, certainly boxing can be considered endurance exercise, cardio, but not really. For me, it's a form of agility exercise, and one gets more skilled. It's a wonderful program. There are many programs throughout the world based on boxing, and participants love it. The evidence for tango is very compelling, but there's nothing unique about tango. Dancing is a wonderful activity. It's a wonderful activity one can do with a partner. There's been publication after publication showing that tango is very, very important for helping and benefiting people who have Parkinson's disease. Now, I have a group of about 30 to 40 people who we meet on video once a month. And Dr. Gilbert was very kind and talked to them. And I'm now going to show you a picture of a few of them. They sent me a very, very nice greeting. It's called a kudo board on Thanksgiving. And these are individuals with Parkinson's disease. And have no doubt, okay, these people, and there were many more than this, but we just have 4 here. You can see a person boxing in the middle, and you can see a person out there in the mountains. And I'll just read you what one of them said. She says, Dr. Corcos, thank you so much for your work. The bottom line is, she says, I honestly feel I am doing better with PD today than I used to. So I'm going to walk you through the science. The science is compelling, but there are also many, many testimonials from people who will tell you that they feel much, much better. So the question some of you may have who haven't been exercising is, how do I start to exercise? What do I do? Now, first of all, you need to discuss your exercise plans with your doctor, especially if you're just starting off. The physician may want to give you a health screening exam, and you should tell them what kind of activity you're doing. And the likelihood of there being a reason for you not to exercise is very, very low, but why run the risk? And then ask your doctor for prescriptions for either physical or occupational therapy. It's good to see a physical occupational therapist very early on. It's standard practice at many programs in America, standard practice in Holland, and then they can get a baseline assessment of where you are with your disease, and then they can look at you every 6 months, and then they can see if you need a little tune-up to a particular part of your exercise prescription. Some people are very good alone, some people aren't. So for those of you who like company, and company is great, consider joining a friend for added motivation. And there are now many, 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 many exercise classes, and one can do classes from around the world through Zoom, and they are very, very good. And many, many towns have programs, and I'm sure that APDA and others can help you find a program. Try to find an instructor who has expertise in Parkinson's disease. There are more and more such people out there who understand the disease. You want a ratio of class members to instructors which is low to maintain safety. Clearly, early on in the disease, this is not an issue. If you are having postural instability, then safety is key, but keep on exercising. And also to find programs that fit your level of mobility. Very popular programs at the place that I work out at are done in the water, aquatic activities. Falling over there is not a risk. And I want to briefly summarize the SPARKS-2 study. Now, this was published in 2018 in JAMA Neurology, and it was basically a feasibility study to see, one, can people with Parkinson's disease exercise at 80 to 85%, which is high intensity, and will they do it for 3 to 4 days a week? And so we had 3 groups, 80 to 85% maximum heart rate, 60 to 65%. And then we had a waitlist control who were crossed over to one of the other 2 treatment arms. This was so that we could compare progression for those people not exercising in the SPARKS protocol with those exercising at 2 intensities. And the data showed that after 6 months, the high intensity group had only changed by 3 points, and disease progression can be anywhere between 3 and 6 points. Now, this was not a definitive study. It was a phase 2. It used a very complicated analysis, and it should be considered preliminary, but it was sufficient evidence to go on to SPARKS-3, which I'll talk to you about next. SPARKS-3 is a currently funded NIH study, and people can either refer themselves or they can get a physician to refer them. We have a pre-screen, we have a screening visit. People get a DAT scan, which we use both for eligibility and to ask the question, is there any change in the dopamine transporter system, beneficial change, as a result of exercise? We randomize people to 2 treatment arms. It's very important to stress here that there's a principle, it's a complicated word called equipoise. At the moment, there is compelling evidence that both treatments are good for you. There's a hint that maybe one is better, but both treatments are very good. So it doesn't matter which treatment arm one is assigned to, it is beneficial. We have masked assignments The treatment program lasts 18 months. The final assessment is at 24 months. I'm now going to walk you through the intervention. And what we basically have are 4 supervised sessions, 4 more supervised sessions in week 2. Then people are unsupervised most of the time, although everybody wears a heart rate monitor. You can see the heart rate monitor there. And we have a very nice app so we can precisely titrate the dose of exercise. So we're doing this very much the way one would do a drug study. We are after the best dose of endurance exercise. And so we monitor heart rate very, very closely. I want to briefly talk about how the study is organized. This is a very large study, and you can see here we have an executive steering committee, we have institutional review board oversight, we have data safety and monitoring, and we're recruiting, as you'll see in the bottom, in 27 sites in the US and 2 sites in Canada. So I want to show you the sites, okay? Because many of you will be tuning in from different places throughout the USA. And here we have a map. Now, Dr. Gilbert is in New York, and New York has 2 sites. So there's New York University Langone and Columbia. They have terrific neurologists there. They have wonderful Parkinson's disease expertise. So for those of you living in the Big Apple, there are 2 sites very, very close. And then there are sites throughout the rest of America. Unfortunately, we haven't managed to cover all the states and all the sites, but hopefully there is a site relatively close to you. So at this point, I'm going to conclude my presentation, and thank you. I'm going to invite Dr. Gilbert back, and what she will be doing is she will be hosting the question and answering session. And the way this will work is that I will answer all the nice, easy questions, and she will answer all the extremely difficult questions. Thank you, Dr. Gilbert.
That sounds like a plan. All right. I'm getting a little feedback. Is that a issue? Okay, we're good. Thank you. So Dr. Corcos, that was fantastic. Thank you for introducing our topic and for introducing our audience to the SPARKS-3 trial, which is incredibly exciting that we're going to finally have data that proves once and for all the importance of exercise, and especially endurance exercise, and how much it helps Parkinson's. So really excited to see the results of that trial and to see how that trial is developing. So that's really exciting. Now, I know our audience is bursting with questions for you. And in fact, during registration, we received hundreds of questions, actually. But if you are listening today and you have a question for Dr. Corcos, you can ask it live right now through the live chat on either YouTube or Facebook. Now, I want to just alert everyone that if you do ask a question that way, you will need to be logged in to YouTube or Facebook, and we may display your question along with the name and photo that you're logged in with. So be aware of that. So let's start off our Q&A. And this is a question that has come in many different forms during registration, which is the question of motivation and Parkinson's disease, and especially exercise in Parkinson's disease, I should say. And especially during COVID, when people had to take a break from their exercise for whatever reason, weren't able to get on Zoom, don't do as well maybe on an exercise program by virtual modalities. What can you say about motivating a person with Parkinson's to exercise?
This is a very, very difficult question to answer. And if anybody can really come up with a motivational pill, etc., it will be really great. The reason I do the research is to provide the evidence in such an incontrovertible way that when physicians talk to people with the disease, they can tell them unambiguously it works. It reduces your symptoms, it may give you a neuroprotective effect, and it would improve your cognition. And so my hope is that for the many people who find, and I won't even use the E word here. I know there are a lot of people who don't like the E word, okay? But think of it as an activity. You can go walking. You can do a lot of things. And at the end of the day, I think if one is struggling to get motivated, one just has to find cues that work, whether it's going out for a walk with a partner, whether there are many different ways to try this, but the most important thing is to come back to the evidence. And the evidence is very, very strong. And many physicians will talk to people with a disease about exercise right up front, maybe even before medication, because at the end of the day, the pharmacology will work on various neurotransmitters to some extent, but they don't impact the whole body. There is no pill yet which is going to help your heart, which is going to help your brain, which is going to help your bones, which is going to help your flexibility. So it's a wonderfully potent pill, exercise, that's pill in quotation marks. And at the end of the day, I think one just has to tell oneself it's good for one. It's a little bit like, and many people use the dental model when looking at Parkinson's disease. Do people like to brush their teeth? Probably not. Do they like flossing? Definitely not. Do they like those little picks that go through their teeth? Probably not. But they do it because gum disease isn't fun. So, but the not fun part is why you should try different things. So if one activity doesn't work, if you look back at that slide, you saw the person gardening. He had a great big shovel. Now, maybe he doesn't like going to the gym and doing weights, but if you're outside shoveling, it's beneficial. So I don't really have a clever answer here, but I can tell you that the evidence is completely overwhelming. There is zero doubt here.
I think that is very motivating. You know, if you want to give somebody motivation, have the proof, and that's what you're doing. So thank you very much for that. We have a great question from Thomas. So you mentioned the 4 types of exercise, the endurance, the strength, the stretching, the balance. What would be a good schedule, a good weekly schedule, you know, in very practical terms for somebody who wants to tick those 4 boxes?
Now, this is a very good question, Thomas. And I'm going to give you a complicated answer because it's a complicated question. So the first thing you have to decide is, are you a 6 or 7 day exercise activity person? Talking to people on the video group that I work with, many of them are 7 times a week people, and they find if they don't do exercise for a day, it just gives them a worse day. So you have to decide how many days. I work out at quite high intensity, and I need a day for my body just to recover. So once you know the number of days, you can then fit it in. So if I had Parkinson's disease, I would definitely do 3 to 4 days a week of high intensity endurance, 80 to 85% of my maximal heart rate, 30 minutes, that's the 120 minutes, close to the 150 of CDC, a little bit more than their recommendation actually for the higher intensity. I would do weight training twice a week, and I would do it for an hour, maybe 75 minutes, and I would really work on my muscle strength, because as the disease progresses, the stronger you are, the more you can deal with the disease. There's also evidence from pretty much every disease that reductions in strength are a clear predictor of mortality. The best work here is probably in the area of cancer, but it's in many other areas. Now, when you're warming up or cooling down from those 2 kinds of exercises, you can certainly do some balance and you can do some stretching. So the evidence is best that you stretch after a workout. So if it was me, I would probably do 1 day a week of yoga, Tai Chi, but I would include the stretching and balance as part of my other days. So that for me is the exercise prescription. It's 3 to 4 days of endurance exercise, 2 days of resistance exercise, possibly 1 day on yoga, Tai Chi, and I would interweave the stretching and balance. And there is no doubt, zero doubt, that will benefit you.
Fantastic. That's excellent to have such very detailed instructions. And that actually leads us to a great question from Larry, who sounds like somebody who is able to do such intense exercise as you just indicated. So for someone like that, and they decide to or enroll in the Sparks 3 trial, does that person have to stop their other activities and just do what the Sparks 3 trial protocol suggests? How does that work?
You can continue to do what you're doing, but you can't add. So, for example, if we said to people, you can't continue to walk your dog, this would be very bad for the dog. It would be very bad for the person. It would be very bad for recruitment, and it's not necessary. And so whatever you've been doing, you can do. But the whole point of this study is to directly compare 2 treatment arms. And we work very, very, very hard not to have the 2 treatment arms contaminated. Because if the 60 to 65% starts to work out like the 80 to 85% group, we have no study. So just to let you all know, a phase 3 clinical trial tests what is called a superiority hypothesis. That means one treatment arm is superior to the other. And so if one of the treatment arms starts to look like the other, and this happens all the time in studies, then you will not get your result, and that will not be good for science. And so it is an unfortunate fact that if you are working out quite intensively, then it's great for you. It just means you're not a candidate for Sparks 3.
Okay. All right. Thank you for that clarification. Our next question is from Rupal. She is curious specifically about yoga and how yoga fits into the paradigm that you've set up with the 4 different types of exercise. Is adding yoga to an exercise regimen helpful in Parkinson's?
Well, I think the answer is absolutely yes. I reviewed a meta-analysis. One of the things that scientists do is review articles, and one form of literature is what is called a meta-analysis, where a scientist goes through and looks at all the studies on a particular topic and asks the question, what is the collective wisdom of all the studies? And the collective wisdom is that yoga is beneficial. The issue with yoga, and if you practice it, you'll know this, is there are, I'm not sure how many types, but there are many, many types. Some are not very vigorous, and some are. So if you look in the literature, there are studies where people have done very, very vigorous yoga. It's very much akin to doing weight training. You're doing push-ups and all kinds of resistance exercise, and it's very, very good for you. It's also very good for anxiety, depression. So, and here a physician can help you. It's really good to know what your constellation of signs and symptoms are. If you are quite anxious, then I think there is a lot to be said for yoga. I think it very much is a mind-body approach. Many of the physicians I work with certainly recommend yoga. Then it now becomes a question of where you fit the yoga in. So yoga isn't, if you're doing the less stressful yoga, I would do it on the 7th day, at least one session, and maybe even a second session in. That's very much what I'm thinking of doing, because I think over the winter I probably need to do some yoga. And it's not very stressful. It's not very demanding. You don't have to, like the last 5 minutes of a 30-minute endurance workout. Yes, you've got to get your mind engaged to get yourself through it. So it's hard. But the yoga isn't. And so I think the most important thing here is to listen to your body. I talk to a lot of people for whom tremor is their primary sign. And tremor is quite hard to treat. It's not the easiest of the signs and symptoms to treat. And so I think it's a question of getting to know your own body and certainly try it. I'm a big, big fan of yoga. The more vigorous it becomes, then you can perhaps replace it with one or two of the weight training activities, if that's what works well for you.
Excellent. Thank you. That your comments about yoga and tremor actually dovetail right with a question from Dave. And he asks, is there such a thing as too much exercise when it comes to Parkinson's? Because what he notices is that when he exercises a lot, his tremor actually increases. And what are your comments on that? And I also would like to incorporate your thoughts on what about somebody who is just listening to what you say about all of that exercise you need to include in your week and is just completely overwhelmed because they're very far from being able to do that kind of a regimen. What would your comments be to, one, a person who feels that maybe their symptoms get worse when they exercise, and two, somebody who feels like exercise is just too daunting, especially when it looks so intense and full?
Well, let me deal with the second question first. The evidence here is, again, very, very strong. Most people are so deconditioned and are in such bad health that anything is really good. So I don't want people to think that you have to be doing 7 days a week. Right now, I'm talking to 1,500 people, and I talk to people all over America, and everybody is different. And some people are really evangelical about exercise, and other people want really, if you like, the minimum amount. It's my job to tell people what the literature says. That being said, anything is better than just sitting in a chair and not moving. So if one just gets up and walks around one's house, if one goes for a little walk around the block, that is all very, very beneficial. Probably won't give you any neuroprotection. So it really depends what you're looking for. But I do not want you to walk away thinking, oh, I've either got to do it 7 days a week or I get nothing. There's a lot of evidence out there that all types of movement are good. I'm just giving you the evidence, what the evidence says is optimal if one can fit it into one's life. And of course, everybody here is at a different stage. I was talking to a neurologist in Utah before this conversation, and she's 37. Her classmate was diagnosed at the age of 37. So if you're at 37, you have a different set of challenges in front of you to if you've just retired and now you may have more time on your hands. So now in terms of too much exercise, yes, you can have too much exercise. Now there aren't any studies, but again, you have to listen to your body. If you're run down, if you think your immune system is suffering, if you're pushing yourself too hard, I tend to view the way people with a disease should think about their disease. It's no different to how an athlete. So some athletes need to be pushed. Others need a coach to say, take time off, because rest is really good. So I don't want you to think I'm all about exercise. I'm not. I'm all about the right exercise, the right recovery, and the best sleep one can have given the constraints of the disease, which can negatively impact sleep. Now, when one has the tremor, this is really, really hard, okay? I'm now getting this from two of the people I talk to every month on the Zoom. Their view is they absolutely would not consider stopping exercise because they see the long-term benefit. So think of exercise as having two effects. One is a short-term acute effect. You go and exercise, some people get a high, some people feel a little bit tired afterwards, but the result of exercising, you get an effect that may last a few hours. And if in that case your tremor is getting high, then maybe some relaxation exercises, maybe half an hour, maybe a little bit less of the exercise and a bit more of the yoga to calm the system down. Much of this is going to be trial and error. And everybody's different. And as Dr. Gilbert will tell you, if we have an audience of 1,500 people, we do not have 1,500 people with the same disease. Okay, there are multiple versions of Parkinson's disease. It manifests itself differently in different people. And so I think you have to listen to your body. And if you're pushing it too much, if you basically think that if 30 minutes is good, 60 is better, and therefore 90 must be terrific, there is the law of diminishing returns. And I think there's definitely the law of diminishing returns in exercise.
Fantastic. Very good. It's all a balance, and there's no one answer for everyone. So thank you very much for that. Susan asked a question. You talked about the SPARKS-3 trial. There are sites all around America. Do you have a shortcut for people if they want to consider participating? Is there an easy website we can put up in our chat? Is there a phone number that we can practically give to people to allow them to further decide whether they can be SPARKS-3 participants?
Hi, Susan. I see your picture has come up. There is a website. It's sparkspd.com. So if you just Google SPARKS-3, it'll come up. It's the second or third or sometimes the first site that comes up. You can always contact me at my email address. You can go to a website called clinicaltrials.gov where they advertise all of the studies, and perhaps Dr. Gilbert and her colleagues will decide that there is or is not a place that this can show up on the APDA website, which is really quite terrific, helpful, and informative.
Absolutely. We actually have put the website on our public chat. So there it is, sparks3pd.com. And so you can go to that website and find out more information. So thank you very much for that question.
Well, Susan, we hope you can make it through, and we hope you can take part.
Fantastic. Pamela's question is an excellent one, which you touched on briefly. We want to flesh that out a little more. What about intense cycling and its effect on PD? Can you talk about cycling? There's forced exercise as part of this topic as well. Could you address that for our audience?
Yes, so cycling is terrific. It's very good for you. And for those of you who enjoy cycling, I would certainly encourage you to do it. It's a wonderful activity alone. It's a wonderful activity in a group. I'll be very clear. People use the term forced exercise. So the brains behind this is Dr. Jay Alberts, and he's published several studies. He has an ongoing study. And the idea is that he went across Iowa in the early 2000s with a friend of his who had Parkinson's disease, and they biked for over 400 miles. She was on the back of the tandem, and the way that the tandem works, she was forced to have her legs revolve at the same cadence as Jay Alberts, but he was actually putting out much more force. And so she was just following along at the high speed, and they noticed every day she was getting quote unquote better. Her posture was improving, her handwriting was improving, and it's very, very good for one. And for those of you who like cycling, you should cycle. I would not do only cycling. There are problems with only cycling, one of which is it's non-weight bearing, so it's not great for osteoporosis. You can look at elite cyclists and they have osteoporosis. The other thing is that when you do exercise on a treadmill, you are walking and you're learning how to walk at a faster speed if you increase your treadmill speed, and that there is evidence that this does transfer from the treadmill to overground walking. So I'm a big fan of Dr. Albert's work. I'm a big fan of cycling, and I would encourage you to do it. But, and I'm guilty of this also, it can be quite addictive, and you forget about everything else, and you end up with weak little arms, osteoporosis, you have huge quadriceps, you have a big heart and big lungs, and that's not optimum. So again, it's a question of balance.
Very good. So many things to consider. We have a great question. This may have to be our last question also, as our time is really running by. Maybe we'll fit in one more. And this is one that I'm sure is on a lot of people's minds. So let's say somebody has PD, but they didn't quite realize how important exercise was when they were first diagnosed. They're now 5-10 years into their diagnosis. Does it make sense to start now, or are they too late?
Never, ever, ever too late. And in fact, the further you're into your disease, I think the more important it becomes. As I mentioned partway through my talk, but I'll go into this in more detail. If you go and look at a lot of elderly people, forget the Parkinson's disease for a moment. Their ability to get in and out of a chair, their ability to get in and out of a bath, their ability to move around starts to get really quite compromised. And if you look at people, you'll see they start to use their hands more and more. And so their hands are an accessory. And so I think one should be exercising pretty much at any stage of the disease. Now, we're not talking here about anything particularly vigorous. There are what are called therabands, which are kind of light. There are bands which you can pull. You can have them of different resistances. You can have them at very high resistance. You can also have them of very, very low resistance. If one's legs are really struggling and they're not really working very well, you can go into special gyms. There are more and more of these around where you have an arm device. So you can basically do you can do your exercise using your arms. But there is no time. In fact, the more that one is getting, the more advanced the disease becomes, one can argue the more reason to exercise. So I know it's harder, and I think one may need a very, very special therapist, somebody who can give you exercises. But for those of you who are who've had the disease for many years, and if you are struggling to get in and out of chairs, you will know how much you're using your arms, and therefore you will know that if your arms are just a little bit stronger, because at some point you may not get out of the chair. And at that point, you're going to need a lot of help. And at that point, you'll realize that anything that one can have done to maintain upper body as well as lower body strength can only be good for one's ability to ambulate.
Very good. Thank you very much. And this is going to be our last question. So it's from Katya, who has a question. Is it more effective to practice a well-known sport, something that you're very familiar with and that your brain is familiar with, or to try something completely new? If you had to choose between those two, what would your preference be?
Well, the question is very clever, but I think that one should not make that choice. So there's a lot of work that's been coming out of USC. Dr. Petzinger is a very well-known neurologist which talks about neuroplasticity, and we certainly want to keep the brain as plastic and adaptive as possible. And so new activities are really, really good, but they're going to work on brain plasticity, and you're not going to be getting your heart rate up. And so you're really working different systems. And so new activities, if one takes up dancing, a different form of dance, works the brain plasticity, but it's not working your cardiovascular system. Whereas once you get comfortable on a bike, and once you can really get your legs strong enough and you can get your heart rate up and you can pedal away at a cadence, according to Jay Alberts, of about 90 cycles, then you're really going to do your heart well. So I think a lot of times people want one over the other. So I can tell you, if you ask me, should I drink red wine, white wine, rosé, or champagne? I would say all of them in moderation, and it depends on the food, time of day, and location.
Fantastic. So really, there are no easy answers. All these elements of exercise are important, and trying to incorporate as many as possible is really the key. So thank you very much, Dr. Corcos. We are going to end our Q&A there, unfortunately, because our time has come to an end. But I want to thank you so much for all that wonderful information. And I want to thank everyone who participated today in today's discussion, because your questions were really on point and really offered a lot of new information to our audience as well. So thank you so much. Now, if you know someone who missed today's program, if you joined late, if you would like to watch again, this recording will be available later today on our YouTube channel. So don't forget to subscribe to APDA's YouTube channel to watch new videos and live broadcasts. Before we go, I want to highlight some of APDA's exercise resources that you can access now that we've had our wonderful broadcast about exercise. We have an exercise handbook entitled Be Active and Beyond, and this displays step-by-step instructions on how to perform exercises for PD at home. This book is available in English and Spanish and can be downloaded from our website. So be sure to check that out. APDA also offers a Parkinson's-specific training for fitness, health, and wellness professionals, which can also be accessed on our website. These links will be posted on the public chat, so see them there. And this is important for somebody who wants to train themselves in Parkinson's disease and offer classes to the community, so check that out. We also have an ongoing webinar series entitled Let's Keep Moving with APDA, and this focuses on practical information to keep you active at home, and including how to set up a home exercise area, how much exercise to do at home, how to exercise if you have pain, etc. So check out all those archived episodes on our YouTube channel, and you can sign up for additional episodes as well. Now, for additional information and resources about Parkinson's disease, visit our website at apdaparkinson.org. We have a lot of great information there. Now, the next episode of Dr. Gilbert Hosts will be held on Wednesday, January 5th, and this will be at 8:30 p.m. Eastern Standard Time. I'm going to be hosting 4 people with personal experience with young onset Parkinson's disease. They're all continuing to live their lives with optimism and vigor, and we're going to be talking to all 4 of them. We'll be talking about dating, marriage, family, kids, work, exercise, and managing all of that while having Parkinson's disease. So please do not miss this next broadcast. You can register for that session as well as many other virtual programs using our virtual calendar on our website. If you go to apdaparkinson.org/events, scroll to January 5th and register for that next event. If you enjoyed today's program, we hope you will consider supporting APDA with a donation, because with your help, APDA can deliver more programs and services like this one. Thank you so much for joining us today. We hope to see you very soon on another APDA program. Have a wonderful afternoon.